My bad.
Our presentation centers around chemotherapy, pregnancy, and neurodevelopment. Just a quick overview, this presentation will include what chemotherapy actually is, its effects on the body, how pregnancy may complicate, and an analysis of study on chemotherapy and neurodevelopment.
So, why did we choose this topic? Our group is interested in this topic due to our unanimous want to go into a healthcare profession in the future. Many of the careers we are interested in involve working closely with pregnant individuals and their children during and after labor. And we are also interested in this specific topic due to the large impact cancer has on our society as a whole, as well as the impact it has personally had on some of our own family members.
So, what is chemotherapy? Chemotherapy is a type of cancer treatment that is usually given as an infusion, injection, and sometimes an oral medication. Its goal is to stop cancer cell reproduction. There are many types, but they all work similarly. Chemotherapy may be used alone or in conjunction with other cancer treatments, such as radiation.
How does chemotherapy work? So, some chemotherapy drugs contain alkylating agents that stop the cell from reproducing by attacking a cell's DNA. This interferes with the cell cycle. Chemotherapy drugs typically interfere specifically with the mitosis and synthesis phases of the cell cycle. Another type of chemotherapy specifically changes the metabolism of a cell, called antimetabolites.
Effects of chemotherapy. Though not every patient has side effects, a few possible examples are hair loss, fatigue, nausea and vomiting, weight changes, and mouth sores.
Chemotherapy and pregnancy. Chemotherapy is not recommended in the first trimester of pregnancy because there is already a high miscarriage rate and possible birth defects. The study we read focused specifically on the brain and the brain function of children who were exposed to their mother's cancer treatment in utero. While the study included different varieties of cancer treatments, its main focus was the effects of chemotherapy on the neurodevelopment of these children.
Anthracyclines and platinum-derived chemotherapies were two of the main chemotherapy varieties that our specific study focused on. There was some evidence that a lower fiber density in cross-section, called FDC, in the brain may be attributed to platinum derivatives in chemotherapy. This means it may affect the white matter of the brain. There are also differences in brain structures between those children exposed to platinum versus those exposed to anthracyclines. During the study, intelligence tests were performed on both the control and the study group. Some of the data indicates the difference in intelligence of children who had been exposed to chemotherapy and those that had not.
The conclusion of the study determined that in most cases, the risk is greater than the benefit if only looking in regards to the child. It affects brain development and thus impacts the rest of the life of said child. With that said, platinum derivatives during pregnancy were indicated as a potential risk factor for decreased cortical gyrification of the left superior temporal gyrus. However, chemotherapy during pregnancy in general did not significantly contribute to these findings, resonating with earlier findings. So, based on the data gathered, it was concluded that anthracycline-based combination treatments may result in a lower risk to the brain development of a fetus compared to other forms of chemotherapy.
One possible exam question is, what might the prenatal exposure to maternal cancer and its treatments affect? This can affect both the brain structure and behavior. Another one is, children in which group showed slightly lower total IQ? Children in the control group or children in the study group? Children in the study group had slightly lower total IQ than those in the control group.
And here are our citations.